First of all, I welcome the Cass review, and I want to thank Hilary Cass and her team for the thorough and thoughtful and careful and sensitive way in which they've undertaken this research in an area that, you know, when you look at the children and young people involved, and actually, you know, the adults in our country as well, who are, I think, desperately worried and frightened about the toxicity of this debate. I think she's done a really important piece of work, but I think it does raise some serious concerns that are pretty scandalous, actually. I think we've got to ask ourselves, you know, why is it that we've seen medical interventions that have been given on the basis of very weak evidence?
Yeah.
How is it that clinicians have been silenced or afraid to come forward? Why is it that a group of young people who are extremely vulnerable are waiting years to access treatment? And I think there's plenty of blame to go around. I'm pretty angry, actually, that despite this review having been commissioned, there are some NHS trusts that refuse to cooperate.
Yeah.
And I want to send a clear message to them that under a Labour government, there will be accountability for that. You're not going to get away with it. And I want to work constructively with the government to make sure we get this right.
We're back to the consensus on that. So under a Labour government, none of this nonsense is coming back. None of this, you know, evidence-free.
No, we're going to take
mutilation of children.
an evidence-led approach to this.